Good morning, everybody. Well, before I get to the standard bits of introducing Joe Rycroft Malone, I'd just like to personally acknowledge the contribution that Joe's made to the realist research community over many years, with a couple of illustrations from my own research career. So back in 2005, when I was starting my PhD research, I can remember coming across Joe's What Counts as Evidence and Evidence-Based Practice paper in the Journal of Advanced Nursing. And as someone with a clinical background, this was really important to me, that someone was making the case for a non-reductionist definition of evidence, that it could be from research, it could be from clinical or lived experience, or from routine data, and so on. And the other example is from much more recent as well, and is thanks to the fact that we have open peer review processes in some journals, where you get to know exactly who it is who's spending the time to make those insightful and critical comments that really improve the research that you do and the way that you report it. So I'd like to personally say thank you to Joe for that. So Joe is Professor of Implementation in the School for Healthcare Sciences at Bangor University, and is Director of the National Institute for Health Research, Health Services and Delivery Research Programme. And she's presenting on getting realist studies funded, what works why, and in what contexts. And seamlessly, I hope we can bring up the actual presentation. I don't know which one to go for.
Great. Thanks, Mark, for that generous opening, and welcome to me. So, I am tasked with talking to you about getting realist studies inquiry funded, and I'm doing that from a number of perspectives, so wearing a number of hats. So Mark's already indicated that I'm interested in advancing the methods realist researcher. I'm an applicant of at the NIHR HS&DR programme, and also NIHR Health Technology and Assessment programme. And I also am wearing a hat as a funder. So from November last year, I became the director of the Health Services and Delivery Research programme. So I'm talking to you with a number of different hats. What I will say is, as a disclaimer, if you like, for the Department of Health, is I'm speaking in a personal capacity. Anything that I say is not something that necessarily the Department of Health would support, although I'm sure I'm not going to say anything that they wouldn't support either, but I need to say that. I gave this talk quite a lot of thought when I was on holiday recently, and for some of you know me, I know at least a couple of people who know me, and some people know me from Twitter, that I've recently been on a sailing holiday, and I've over the last few years recently begun to learn how to sail. And when I thought about it, and the sort of process for getting funded, I thought actually it is a little bit like sailing, like mastering the waves, because you really, as those of you who might be sailors yourselves, really need to understand the conditions, the context in which you're going out. You certainly need to know how to handle the boat, how to plot the course, and understand some of the decision points along the way. You certainly feel when you're sailing that if you're wind against tide, it's rough. And for those of you who have been through application processes, sometimes it's rough. And then there's something about how we get better at being better sailors, or better, more successful at grant capture. So I've sort of framed, if you like, what I'm going to say around understanding conditions, understanding some of the sort of the waypoints, if you like, and some of the things that I think would be helpful for us as individuals, and potentially us as a community, to think about how we might move things along. First of all, I am going to say a little bit about context in relation to the NIHR, and specifically about the Health Services and Delivery Research Programme. And I'm going to try and do that in a way that doesn't disadvantage those of you who can't apply for NIHR, those of you who may come from overseas, and make some general points. But to give you a sense of the context that certainly we're operating in the UK, but also the rising tide of realist work, realist-funded work that there is in the UK. And we're very, very, very familiar with what works for whom, in what context, in what circumstances, in what respects, and why. And this is, I think, in terms of the NIHR and the sort of work that gets funded through the NIHR, quite a attractive, very attractive sentence, coat hanger. And it's certainly very attractive to the sorts of research that we fund through the Health Services and Delivery Research Programme. The HSNDR programme its primary evidence users are policymakers of all different sorts, the public, the patients, of course, health professionals. And we fund research that is through two streams, through a researcher-led, so you go with your idea and put your idea, your proposal forward to the researcher-led stream. We also have a commissioned stream, which is highlight notices around particular topics. And those topics haven't come out of our own heads, they've come out of quite large, extensive stakeholder engagement processes. And what we are interested in doing, and this is where we come to the attractiveness of what works for whom, why, etc., within the programme, is funding research about the quality access and organisation of health and care services. If we unpack what that means, then we're talking about multifaceted interventions, and therefore complicated interventions. We're talking about how and why they operate in the context of the health service and care services more generally. We're interested in understanding that from the point of view of different evidence users, different stakeholder perspectives. We're interested in understanding the potential impact of different sorts of interventions in their real-life context, how things could work better, how things might work if they were stopped. So stopping things, what does that sort of impact does that have on the service? And critically, we're interested in relevant and timely research, and that includes attention to both formative and summative outcomes. So you can see how there's a really neat match between what works for whom, in what respects, and the sorts of research that we're interested in funding, particularly within the Health Services and Delivery Research Programme. And if we look across the portfolio, the NIHR portfolio of funded studies, we can see the growing popularity of realist research. So what colleagues in University of South NetCC, the administrating body for HSNDR, did for me kindly was did a word search basically, and I asked them to search for anything that had a whiff of realist in it. And I'll come to that in a minute. And what we see here, I didn't do a proportion of the other funding programs, but what you can see is that at the moment and that have been published in our portfolio, we have 30 studies that have a whiff of realist in them. And if we look then at those studies that have been funded and some published, the next slide gives you some examples of those. They're varied, very varied. So we go from some public health research funded studies around peer support, community engagement, and as far as I can see, there are no current public health research funded studies these are published already. So there's nothing live in the system. To the HTA, who are calling now for realist syntheses around topics such as abdominal massage for bowel dysfunction, improving fecal incontinence for people with dementia, to the HSNDR programme, which are probably more familiar with the sorts of topics that we have funded there. And some of you indeed have been successful at getting funding within our programme. So the question that, and I'll come to this again, the question that perhaps we might want to think about is the relevance of realist research for different sorts of topics. So I am involved in the HTA realist synthesis, interventions to improve fecal incontinence in people with dementia. And I think it's been extremely challenging to do a realist synthesis on understanding the effectiveness from a HTA perspective of improving fecal continence in people with dementia. But perhaps we might come to that as a discussion point. So then I thought, well, given I'd said try and find things that have got a whiff, anything that's got a whiff of realist about them, how realist is an NIHR-funded realist study? And so I looked across, and just from my own experience as well of looking at many proposals now that are both realist and non-realist, of course. And I think what we can do is categorise the realist in realist-funded studies as full, partial, and light. And the volume goes along with this pyramid. So I'd say the full, there are fewer of, the partial, there are more of, and the light, there are a greater number of. So when I look at the characteristics of full, partial, and light, this is my take, if you like. So what we have in realist light is we often will see people say that they're going to do a realist-informed study, and then it's not always clear how realist-informed the study is going to be. They will use the very attractive, very seductive, what works for whom, in what context, in what respects, etc., to frame their proposed research. But then it's not clear how they follow through on that. And then often they will frame their research as what works for whom in what context, and then go on to talk about identifying mechanisms, but do that in the context of identifying mechanisms as part of a logic model. So then we have questions about understanding the philosophy, underpinning realist inquiry. So then if we go to realist partial, so often what we'll see are studies that will have a phase one of a bigger programme of work, such as a trial, a feasibility trial. So we'll have phase one as a realist synthesis to try and dig into what might be, and try and dig into and explicate what might be some of the components of a new intervention that might be then tested in a feasibility trial. We also will see realist components in mixed methods review studies. So, for example, I was involved in a multi-method review study funded by the Health Technology Assessment Programme, which was looking at the reduction of repeat teenage pregnancies. And the realist component was only one component of a number of different components, including a systematic review and meta-analysis. And then also, often we'll see in proposals the realist framing of developing a programme theory for. But then the subsequent research might not necessarily be realist. And then we go to the realist full, which I think, as I say, showed you in my pyramid, are the fewer in volume. And we have mixed method studies, including both realist synthesis and evaluation, and I'll come back to that because there aren't so many of those sorts of studies. Then we have in terms of a realist evaluation, we can clearly see how researchers are going to move through the realist evaluation cycle, and what we are seeing typically in those sorts of studies are case studies, doing realist evaluation through case studies, which include, for example, ethnographic methods, less so drawing on more numeric data sources, and I'll come back to that as well. So just in terms of summarising some of the context conditions, if you like, it's what I'm saying, and I hope I'm showing you, that the realist inquiry is clearly, as you will know, as an informed audience, highly relevant to applied health and care research, but I would question whether it might be particularly relevant to some topics rather than others. That I think that the research community has a varied understanding, and therefore we see a varied operationalisation of realist inquiry, and that includes in funded studies. So that's something for me and us to reflect on in terms of being a funder. That there is a growing number of funded studies, which is really positive. Kieran Walsh stood as part of this conference a couple of years ago, and I think at that time he wasn't able to tell you about the volume of realist work that was both completed and through the system. I'm here now to say that the volume is increasing in a positive way, and I think my sense would be that realist inquiry is particularly suited, if we're talking about the NIHR family of research programmes, particularly suited to the goals of the Health Services and Delivery Research Programme. So there are a few things that I wanted to flag in terms of this sort of navigation, finding our way and manoeuvring, if you like. I wanted to talk about sort of the idea of emergence of a method which relies on things emerging over time and getting funded when you need a level of detail. I wanted to talk to you a bit about scope and scale of studies, and then briefly on stakeholders, and then some reflections on the use of standards. So I think I've given you a bit of a hint previously about how obvious the philosophy of realism is evident in the research, certainly that I see coming through the system, and it does vary. So we have I think the studies which we see coming through the system where you can say, yes, I can really see that there's evidence of realist principles is smaller than larger, and then we tend to get it vague to hidden. And so if we think about the issue about the method and the need, if you're going to get something funded for some detail, the funder needs to know a level of detail, because it's the protocol and the team who's written the protocol, who's going to run the research, that clearly gets funded. There's a challenge, I think, a potential challenge, potential tension here. So, and that's a balance around the precision that's needed in terms of what goes in a protocol so that the funder knows what it's funding, versus the emergent nature, I think, of realist inquiry. Now, more than one of you sitting in this audience have been successful at doing this. So we've got a number of successful examples, and those examples are growing. But I wanted to just say a little bit from a funder perspective of the sorts of things that perhaps we would expect to see. So if we have got some principles underpinning realist inquiry, and we do, and we might disagree about what some of those might be, but there are some core principles I think we probably could agree on, that we would clearly expect to see those principles evident in proposals that we review and we fund. And I would suggest that also includes initial ideas, both if you're proposing either a realist synthesis and or a realist evaluation, that we see some evidence of emerging programme theory, emerging ideas around programme theories. This could be more or less explicit, because if you've been working with stakeholders to develop your proposal, I'll come to the stakeholder point in a minute, then you will have some sense about what it is that you are going to be evaluating, going to better understand. And then what we would see, and what we would want to see, is evidence of a robust research process to meet the key principles of realist inquiry. And there's a level of I guess, things that are fixed when your proposal gets funded, and some of you will have experienced this. But there's also there is a level of flexibility. So certainly within the NIHR, we have a post-funding process that enables the managing of adjustments. So you can develop your proposal as things emerge. Things are not necessarily fixed in cement at the point of funding. So the post-funding process does manage adjustments. But clearly it is important to have, for the funder to have some sense of what it is they are funding. So the idea of evidence of the realist principles, a process research process that you're going to meet those realist principles, even if you also are saying that this is going to be emergent and we'll come back to you and tell you how it is emerging. And we will manage that process post-funding. So there's also, I think, a tension between breadth and depth, scope and scale. So we have, in relation to breadth, we certainly from the NIHR perspective, there will be funder expectations about the sort of work and about the evidence that the NIHR wants to generate. And the evidence that the NIHR wants to generate is generalisable knowledge, clearly also theoretically transferable knowledge, depending on how you frame what you're doing. And clearly wants to have answers to the questions that you've posed within your project protocol, or that we've posed with the Commission brief. So those are funder expectations, issues around generalisable knowledge. Versus, from a realist inquiry point of view, potentially versus, and perhaps we can have that discussion, the need for depth. So the need for depth of insight, the need for depth in terms of theory development, of understanding findings within real life context, of this issue of the fact that realist inquiry is something that can potentially continue. And clearly, a funder like the NIHR, or indeed the research councils, aren't going to fund a programme of research, a never-ending research programme. So there have to be some boundaries around what we fund and what we propose as researchers. So managing this breadth-depth seesaw tension is sometimes challenging. And there's some obvious things in terms of dealing with that potential tensions, but there's some obvious things that are so obvious sometimes I think people forget. So being really clear about the reasons for your research plan. Don't assume a knowledgeable reviewer or panel member or board member. So just be really clear, give reasons why you've decided to do what you're doing. Within the NIHR programme, you'd have to give really, really good reason for only doing your research within one department, within one hospital. And perhaps we can come back to how we might get around that. So it's likely that the proposals are going to need some scope, certainly more than one unit in one hospital or one primary care setting. And so I guess we can think about how we can be more challenging with mixing our methods. And this is where I think there is some work that we could do as a community to be more creative with mixing methods. So what I haven't seen, I don't think we funded, are realist evaluation studies that, and if I'm wrong, you can tell me afterwards, realist evaluation studies that have drawn not only on in-depth qualitative methods such as ethnography, but also alongside that drawing on existing large data sets. We see that a lot now in trials work that we fund, but less so in mixed method studies and less so, I would say, in realist evaluation work. Combining more in-depth methods with questionnaire type of methods. So alongside mixing the methods, being more creative is a way of being efficient and expanding the scope and scale of the work without sacrificing a level of depth that you would get from the more qualitative methods. I wanted to come on to mention stakeholders, and I think this community is very expert at working with stakeholders in creative ways. Clearly, we need to be expert in doing that across the research cycle, from the inception of the ideas to the delivery of the research programme, and then of course knowledge mobilisation, which is good to think of and conceptualise as throughout the research programme itself, the knowledge mobilisation piece. But we're now starting to see some really interesting and creative approaches to engaging stakeholders throughout that process, through from generating programme theories to contributing evidence, pieces of evidence, including their expertise as evidence, through to the refining and development process of CMOs, and then through the actionable findings, the other end, if you like, of the process. So we're seeing, and I think colleagues here will have been using these methods, soft systems methodologies, for example. More recently, colleagues that I work with have been using Lego Play to generate the ideas around programme theories. And to do that, because it's quite, I think, sometimes quite challenging to get some of the concepts around programme theory development to a lay audience, if you like, a lay participant. And using these more creative ways of engaging them seems to be fruitful in demystifying some of the concepts that perhaps underlie realist inquiry. So what I'm saying is, if you are going to be going for NIHR funding, and particularly HSDR funding in the future, then be creative. We like to see that creativity in how you engage stakeholders. And critically, you do need to engage stakeholders from the beginning of your idea identification right through the process. I wanted to reflect a little bit on the role of standards. Clearly, the programme has, I think, led the way on funding, not without some controversy, particularly for Ramesses I, less so because we'd funded Ramesses I, Ramesses II. Really important contributions to the field. What, though, we might want to think about, because I'm now seeing it happen, is how these reporting standards are starting to get used as standards for underpinning proposals. So I think, this is an open question that we might continue conversation about. Is that appropriate? How appropriate is that? Particularly given where I started in terms of we do need a protocol, we do need some precision about what we're going to fund. And then, of course, we have a number of successfully published and funded in the system studies, which are more or less good templates for us to draw on. And then again, I would say if we start to get, and I felt personally, I myself now have in my head, and you will see it probably if you read the protocols, 2 protocols in a row in relation to realist synthesis. I have now a implicit protocol about how I will go about doing a realist synthesis, and it's been successful because I've had a number of realist syntheses funded, two as a principal investigator. But there's a risk. The risk is that I won't develop my thinking, my understanding, and move things on if I continue to draw on this template, if you like, in a restricted way. So I just wanted to raise the question about the use of standards, the uses of templates, and get us to think about the risk in relation to stifling creativity and stifling the advancement of our approaches. And then finally, and going back to the yachtsmanship issue, I'm rubbish at knots. I'm quite good at sailing, but I'm really rubbish at knots. So I have to, I can do about 3 or 4 really well without looking at the book or looking at the app. But so this, I'm just using this as a hook into practicing advancing approaches. And what I wanted to talk about, just reflect on 2 things: how we might advance as individuals and a community, the realist approaches. And I also just wanted to reflect on making findings accessible and what perhaps our role might be in that. And I believe, having talked to a couple of you this morning, that might have been a theme from yesterday as well. So in terms of advancing approaches, we have funded research on research because we funded Ramesses I and Ramesses II. But it's not a thing that we do explicitly as a research programme, but ASRC would. So that would be a good place to do research on research explicitly. However, there's no reason why, as part of one's protocol, you can't build in the opportunity to innovate and develop through the processes that you put within your protocol. So I would encourage you to build in advancing the approaches within your funded protocols. For us, as a research programme, there's a real tension, a very real tension in the timing of the research life cycle. So we're providing evidence that we hope will be of use to the service, to patients, to the public, to policymakers. And we're continually challenged with a challenge that we're not providing evidence in a timely enough manner. So the idea of how we can advance our approaches, which provide both formative as well as summative in 3 or 4 years' time outcomes, is something I think we could reflect on and think about how we might do more expertly. And that brings the idea of using what we loosely call more efficient processes, so drawing rather than always saying that you're going to collect new data, thinking about existing data sets, drawing on existing data sets, but also drawing on existing data sources. Now, clearly that if you were doing a realist synthesis, that would be the case anyway, but if you're doing some primary research, think about how you can make your design more efficient by drawing on these other sorts of data sets. And then the other thing I would say is for us to think about that as there's a growing body of realist inquiry being conducted, being published, how can we draw on that to learn more broadly about realist inquiry and how we can do things differently, better. I'm just posing the challenge, if you like, about how we can do this meta-learning as a community. And the other thing I just reflect on, because we're all perfect, I know I am, is that we all like to, because it's in our nature, present an account at the end of our projects that's really neat and really tidy. And we don't, unless we're talking at conferences, I think, we don't often reflect on the messy bits of the pain, the sweat and I have a lot of that doing realist work that we go through. And I wonder how we can learn from that, our doing, if you like, learn from our doing, whilst we need to provide some level of tidy account of what we have done. So thinking a bit about getting that our stories about the messiness out there, I think would be helpful. So that leads to making realist work accessible. So I started off with certainly the NIHR, and I think most programs that are funded by public money would say that we want to provide evidence that's of use to the public, and therefore of use to different sorts of stakeholders. And I think there's a real challenge, a real knowledge mobilisation challenge for us in what's often quite complicated and some complicated concepts within what we do as realist researchers that are sometimes hidden, because that's the nature of realist work, how we can make that accessible. And I'm not suggesting I've got particular answers, I'm posing this as a challenge, that it's really incumbent, I think, upon us to think about how we can bring CMOs or MCOs to life. And then clearly there's a general message about how we tailor to different audiences and different stakeholders. I have messed around with different sorts of media to present findings to different audiences, and I've embedded a link to an animation that we did as a result of one of our realist synthesis projects. So as I say, I'm not suggesting I have the answers, but I do just pose the challenge that I think we need to think about how we can find ways to make our realist work accessible. There is a role, particularly in terms of the timeliness of what we're doing within, certainly within our portfolio, around formative feedback and how we can engage stakeholders to help us to both share what we're doing along the way, but also shape what we're doing, and then help us with that actionable findings message. And I will just say in a very practical way that certainly with all, I think, funding bodies, whether you're irrespective of NIHR or research councils or other sorts of bodies, that it's critical that you build in costs. And these, the costs of knowledge mobilisation are increasing, and that's okay as long as you've got a justification, a rationale for why you've put what you have in the budget. Creativity in terms of knowledge mobilisation is seen as a really positive thing. So, just thinking about just starting to wrap up now. What I haven't talked about is the obvious. I haven't talked about general principles of grantsmanship. And you know, there are things that probably you expected me to talk about that I haven't, and I'm very happy to have that discussion with you in a minute. But clearly, if you want to get funded, you need to understand, but critically, you need to take on board funder requirements. It's an obvious statement, but you'll be surprised by how many people don't take those requirements on board. You do need enough precision in your protocol to be able for the boards and panels to see your intentions, so that you've plotted your intentions. You are challenged for sure with balancing depth with breadth, but that's about providing a rationale, clear rationale for doing what you're doing, and also building in the potential for formative work, for iterative work. That's okay, that's what we would expect to see. It's good that if you can learn and draw from good and helpful examples, and we have some. I purposely haven't highlighted any for very obvious reasons this morning. There are some good examples that could provide some templates, if you like, notwithstanding the caveat about risking and stifling innovation. That you clearly need to provide the pathway to actionable findings for our programme. That's actionable findings, the impact that your research, whether it's a synthesis or an evaluation or both, is going to have on services, patients, practitioners. And then have a go in terms of experimenting. You know, have a go at trying new things within your protocol. Don't take too big a risk, but certainly within the HS&DR programme now, you've got a chair of the board who is very familiar with realist work. You've got a number of people on the board who are also familiar with the realist work. So take a bit of a risk, and if you're unsure, be in contact before you put your protocol in. Check it out with me. And finally, just a couple of thoughts. Realist inquiry is becoming increasingly popular, which is fantastic, but that brings possibilities and also challenges. So be really interested to hear your ideas about how I can, as a funder, can safeguard the principles, either maintain the philosophical roots of the approach, but ensure that the approach develops and ensure that the approach has appropriate application. And then I think there's something for us to reflect on in terms of us as individuals, as realist researchers, and us as a community. What sort of role do we want to take in shaping the future agenda, in maintaining those standards, and in that issue around meta-learning? And finally, bon voyage, and I wish you well. And thank you for listening.
Thank you very much, Joe. We have around 15 minutes for questions. We have 30 minutes. Oh, sorry. Sorry.
I've got till 11.
There should be a couple of microphones.
Where's the microphone?
Yeah. And then, okay, so we have 2 mics and a question at the back.
Hi Joe, fantastic presentation. Jill Westhorpe, Charles Darwin University. I'm wondering whether in terms of that tension between maintaining standards and not stifling creativity, whether you think there's a role in terms, and how it relates to funding of proposals, whether you think there's a role for funding bodies in ensuring that there are critical friends / mentors / some kind of support process built in for the research proposals that are of interest, but where they might be a little light touch in their initial proposal.
Yeah, and I think certainly as a HS&DR programme, I think we're getting much better at that. What I didn't do is go through the mechanics of how the programme works, because it's going to be of more or less interest depending on where you come from, particularly where you come from geographically. So there are usually two stages in the process. So there's a panel stage, and there's at least one member of the panel here I can see today, and then there's a board stage, and it's the board stage where the final funding decision is made, but the panel stage is where outlines are sort of sifted, if you like, and that I think is one critical juncture where we can be more helpful in terms of steering, and then the board is and colleagues can hopefully support me with this, is actually very supportive and tries to be as helpful as possible. It wants to get things funded. We want to spend the money. So I think there's an issue for us as a board in a very general way about taking risks, and I think we're getting better at that. But I think you're absolutely right that we can think through more about how we can be more supporting and guiding through the funding process. It's not. I mean, additionally, of course, we would expect to see, particularly for junior principal investigators, a mentorship system around them more locally. But you're absolutely right, and I think we were starting to work in that way, and I think we hopefully will continue to work in that way and become better at it.
Hello, Joe. I'm Caroline Hudson. I'm interested in participatory approaches with realist studies.
Yeah.
And I've really struggled with this stakeholder involvement from inception in terms of research design when you're talking about practitioners or patients.
Yeah.
Have you got any tips about getting through the ethical maze, involving them in research design before you've got ethical approval?
So my experience would be it depends how you pitch what you're doing at what stage in terms of whether you need ethical approval. So whenever I've done stakeholder engagement workshops, I've not needed ethical approval. So I would suggest that you might pitch it in terms of a workshop, that you're generating an ideas workshop, you're generating ideas. Now, clearly you wouldn't pull the wool over people's eyes about where those ideas might be going, but I've never needed ethical approval. In the workshop, I've been very clear about the purpose of it and the direction of travel, but it's not been an issue. I'd be interested to hear whether others have had that problem. Well, one would hope that the ethics, and I know it's been a nightmare, particularly in England recently, but that things are becoming much more progressive in terms of thinking around these issues, because participatory approaches are quite rightly becoming more and more popular.
There was a question right at the very back.
Hi, great talk. Thanks, Joe. Sue Down, and I've been laughably deemed the realist expert, inverted commas, as a co-applicant in a number of successfully funded projects.
Yeah.
But I've had real difficulty in then convincing the lead applicant to actually do a realist study. And I'm a bit worried about the kind of reification of realism if these kinds of things are funded. And I see a parallel phenomenology being used as a kind of alternative phrase for interviews. And I'm a bit concerned that if funders are funding things that actually are not realist, and then researchers think that they don't have to engage with people who understand a little bit at least about realism, we're on a slippery slope. I'm just interested in your views on that.
No, I completely agree. And I sort of was hinting at that. At that. And I think, you use like a verification. It's like interviews. You use the interviews as an example. I would use grounded theory. So how many times do you see I'm going to use grounded theory to analyse my data? Yeah, I mean, I can't tell you how many times I've seen that in proposals, and then people haven't really got a clue what that is. I am concerned about that, and that's why I posed the question, the challenge about how we as a community can safeguard that. I think I'm now in more of a position to be able to do that, I think, and to influence things. But I think if you have a role if you're not a reviewer for the NIHR, then please sign up to be a reviewer. You would have a role, therefore, in saying, yes, no, this is not more or less realist. I think we post funding as a funder have a role in making sure that studies are realist in nature, truly realist in nature, and now I'm in a little bit more of a position to ensure that that is the case. But I think it's possibly inevitable as people are sort of seduced by the idea, because it's such a seductive, I think, way of thinking about making sense of what's happening, that we really do need to guard against it. So I'm going to try and do my best to guard against that challenge.
Another question? Oh, sorry. Yep, there's one there. And then I'll go to the other person at the back, and then the person 2 rows in front. Oh, hang on. Okay, and then you.
Hi, Joe. It's Tracy Cooper from BCUHB.
Hello, Tracy.
Joe, you made the point about the tension with the research life cycle and the policy practice tension in practice. And as a senior practitioner trying to set policy and programmes, it's a very real issue. There's obviously an element of being able to horizon scan and try and stay ahead of the game. But I'm wondering what other thoughts you've got on how we can close that gap, really, that tension.
So we try and frame the topics that we commission through extensive stakeholder engagement. But one of the things that I've noted, and I'm hoping I'm going to be able to address, is that what we tend to do, we do an extensive stakeholder engagement exercise that ends up in a workshop that is a bit more limited. But what we ask people to do is consider what the challenges are, I think, of today. And I don't think we're very good at getting people to think about what the challenges might be next year, 10 years, 15 years. And I think there are some things that are always going to be a challenge that clearly is a programme we can continue to try and put out there and get some research funded. So, for example, integrated care has always been a challenge, will always be a challenge. Those are the sorts of things that are going to resonate whatever, now or in 10 years' time, probably. I think what we're going to have to do in terms of what we fund and how we fund it is we're going to have to fund more research that is more formative as well as summative in nature. So what we would expect researchers to build in is that more feeding back as they go to the service. Now, I think, and this goes to the point of, I know because I've done it, that engaging with stakeholders throughout the process, given that what I articulated, what you've just supported, that we have different perspectives, different time frames, different needs for different sorts of evidence, that is a challenge. I know that, but I think we're going to have to be more supportive of more participatory and more iterative and more formative types of research. One of the things that I'm building in much more explicitly to the programme is the expectation that stakeholders are involved at the beginning and throughout the process. But it's a real challenge. It is a challenge.
Okay, there's one person at the back and then another couple of rows forward.
Lucy Shuker, thank you for that. On the question of how a community retains some control over the consistency of what realist evaluation is while allowing kind of innovation and all those sorts of things. I think so amongst some of our colleagues at the University of Bedfordshire, I've noticed a kind of a move to describe things as realist informed. And I just wonder if you or anyone else had come across similar attempts to try to acknowledge we don't think this is a realist evaluation, but we understand some of the principles, for example, a thorough look at context, or that there's something in between, you know, the input and the outcome, and we're trying to look at that in more detail. So in terms of mechanism, but an acknowledgement that it's not fully there, and whether or not that you think that's ultimately helpful to almost to have this kind of second tier of we're just circling around this and trying to work out what we're doing around a realist informed approach, and if so, should there be some kind of engagement with that? Or is it kind of black and white? This either is realist evaluation or it's not.
So I think one of the things I would say is that if it's a funded study, and you've been funded to carry out a realist synthesis or a realist evaluation or both, to then say you've done something that's realist informed is not appropriate. So if you start out from saying, I'm doing a realist informed study, then I put the question back to you as a community, because I need support, guidance from you. Is that appropriate? What would we expect to see in a realist informed study? What's the minimum requirement of being realist and informed by realism? That's an open question. I don't know, because I think it's potentially a bit of a cop-out. Sorry for my hard line on it, but...
There's a question a couple of rows forward, and then I'll come over to this side. Person sort of in the middle, no? Okay.
Thank you. I'm Catherine Jack from Nottingham Hospitals and University, and I've just got a query with regard to the importance of stakeholder involvement. Do those stakeholders have to include patients, or can it be just other staff as well? And do you have any suggestions about where nurses, midwives, OTs can get funding to support patients to attend for meetings? Because it's very difficult practically to organise that.
Mm-hmm. So stakeholders would include patients as appropriate for whatever it is that you're studying, clearly, as appropriate for other groups of staff as well. It depends on what stage of what stage you are in your project design in terms of the funding issue, because you can build in stakeholder engagement into your proposal and get funded for it. If you're trying to develop an idea, then traditionally you were able to get seed sort of funding from local R&D type of departments, but the other place now people are starting to get a bit more seed type funding is through engagement with their clerks to develop the ideas. So there, and the other place would be research for patient benefit, smaller projects. So there are a number of different ways that you can get your stakeholder engagement funded, as long as you embed it appropriately within your research cycle and project protocol.
Right. So it could be something that's not entirely complete when you put an application into the NIHR.
You need to show a direction of travel to
You've done some of it.
clear idea, yeah.
Okay.
And a direction of travel in terms of how you think this is going to have an impact.
Okay. Thank you.
Ray Pawson, Scarborough Retirement Home. I thought that talk was really comforting in its breadth and understanding of realist inquiry. I'd like to pick up on perhaps the most interesting point is that your recognition that realist inquiry is adaptive. That does cause a problem for putting in an application, because what you really ought to be doing in the first months, if it's an evaluation, is spending time in the field, finding out what it is you should be looking at. Same with synthesis. Good 6 months in the swamp, finding out which theories, which program theories are worthy of further investigation. Now, you can't put that in an application. You can't sort of be trusted to say, oh, well, I'll go and spend this 6 months in the field. And whatever turns up, I will now investigate it. So I think you're quite right to try and knock that on the head. I have seen some applications that just say that. Trust us. We're realists. So I think you do. People should be expected to include some embryonic program theories of whatever type. But I still see that there's a problem. I think your solution was recognising that it happens, reporting back to headquarters that it's happened, and is that okay? And that I've got a little bit of experience with that. Okay. That can be a bit clunky and cumbersome. I just wonder if there isn't an initial stage, I don't know what we want to call it, rapid review, rapid evaluation, that gets a little further than eliciting the theories that are worthwhile investigating, or a different kind of pilot. And I wonder if there's room in the structure of things for those initial scoping inquiries, and what you think about the issue in
I think
general.
that's an excellent proposal, and I think there potentially could be, as long as we have some sense of where that initial pilot might take us. But it's not any different from funding a pilot trial in that sense. It's just it's a pilot, something different, and that you have stopping rules in a pilot trial piece. But so it would be a similar adapting what exists already in the system to a different method, different approach. I think that's an excellent idea.
Joe, thank you very much for that talk, and I think it's covered a whole bunch of points. Sorry, Jeff Wong, University of Oxford, and unfortunately probably also part of both the Ramesses 1 and 2 projects, so having a bad reputation as being sort of almost like sort of realist thought police. But thank you very much. I think you've raised.
Did I say that?
No, you didn't say that. No, absolutely not. I'm saying that because I think what you said there, and Joe has actually been involved in the projects in terms of sort of being part of the consensus panel and things. I think the point you make is absolutely really important, and I hope that in terms of talking about standards, there is a very clear there is an interrelationship between what you report and what is counted as quality, but you're reporting it because it then allows transparency for individuals to be able to judge quality. But the standards to which you would judge quality are actually slightly different. And they have been produced for realist synthesis stroke review in synonymous terms. And they're found within the Ramesses website and also in the larger 300-plus page report. So there are quality standards for that, and they will be also produced for realist evaluation. So I think I would strongly urge you to look at the two as slightly different issues. One is to enable you to at least have a sort of aide-memoire at the very least of what needs to be reported. I'm going to borrow your analogy of sailing because I think it's a really good analogy. I'm learning how to do something new as well. And what I would say is, I think I wouldn't go out in a large ocean-going yacht if I had absolutely no idea what I was doing. You know, I'd just basically be asking for it, right? And I think that hopefully that analogy comes straight across to just doing any other research approach as well. Yeah, so if we kind of think of perhaps in our lives how we go about learning stuff, we go about learning stuff either because someone teaches you, you go on a course, or, you know, I learned how to ride a bicycle by just falling over endlessly. So you could do it that way as well. So I do sometimes wonder whether the use of terms like, for example, realist informed, partly annoys me. What principles? Which ones? In what why have you used those principles? So if you're going to do something new, I would just say you would never go and run a randomized controlled trial or, you know, a cohort study or database, large database analyses, but just say, well, you know what, I'm just going to read a book and pick it up and do it. So why does it seem somehow acceptable if you jump on a realist bandwagon to be able to do that? And I think that's probably something I would reflect back to individuals or anyone within a project team. Or, you know, and I know that the thing that Sue was talking about of trying to convince someone else, because they've got often very fixed ideas about what they think they're going to do. You know, I think there is an element here of, well, there is meta-learning for us who may be on the road already, but there's actually just plain old learning right at the beginning of the process. So perhaps that's where we could start, because if we all start singing from the same hymn sheet and have an understanding of what are the principles, and I think actually ultimately probably the most important principle is generative causation. Yep, and if the people you're talking to as your co-applicants have no idea what generative causation is, well, that's probably what they need to learn to do, you know, like tying knots or, you know, taking away, before you take away their stabilizers and let them go.
Thank you, Jeff.
Felix had a question. I think there was questions on this side as well.
Yes, right there. Hi, I'm Richard from Plymouth. Sorry, I wasn't going to say anything, but then I thought I had to say something to Jeff, because as kind of an outsider from Ramesses and really still struggling after 15 years of trying to do this, I think the one of the struggles is supporting junior researchers as well, taking on to teams who have different experiences, different ethnographers, others, to take on the realist method is really tough. And I think Susanna, who's in the audience, who really engaged with this, would agree. So one of the struggles is that there isn't a really good template for how to do it. And so I think we've got to really embrace the idea that we still don't quite know how to do this in health services research. So there isn't the standards that are there don't provide a template for getting on and doing it in a way that is really, really helpful for researchers coming from other areas. So it is a struggle.
I think there are a number now of examples that you could put your finger on, the good examples versus not so good examples, that you could point people in the direction of, have a look at this. This will give you an idea of a good piece of realist, whatever it is. So I feel a bit more upbeat about that than perhaps you do, Richard.
Hi, Katie Shern, Sheffield Hallam University. Yesterday there was a few comments raised around one of the ambitions of realist research to be accumulating knowledge, reusable conceptual platforms, conceptual clarity and taxonomies of mechanisms, building up libraries as Ray mentioned in his keynote. And I just wondered what you felt the role of the funder was in supporting the community to do that kind of work, which might not be linked to a specific project outcome, but is, in my opinion, important to actually realise the benefits of realist research.
Yeah, so I think, I mean, I could see, I don't know about the timing of it, but I could see something coming through that was about a sort of a metasynthesis of syntheses, or a metasynthesis of, a synthesis of different projects that you could pull together a particular platform of whatever. Timing of it would, you know, in terms of what the evidence would be there to be able to draw from, but the actual idea of doing some sort of synthesis of existing work is definitely a potential fundable study. If that's where your question was heading. Now, one would have to think through, so what impact might that have? Because going back to the point about we don't tend to fund research on research, so one would have to think through what sort of impact it could have. But if you chose a particular clinical topic, then you could probably think that through quite easily, I would imagine. So, yeah, I'm open to suggestions on that.
There's two questions, and there's one person at the back, so can I ask you one question after the other and you can address both?
Thanks. Leslie Middleton, Victoria University of Wellington. So I was interested, you've described how well the method is in a way that's seductive for researchers. I was interested whether there's actually a demand for realist research from stakeholders themselves. You describe holding workshops with them, and certainly they present problems rather than methods they want to have to solve those problems. But I'm curious about the attractiveness of the method to stakeholders.
My personal experience, and I think thinking about different contexts as a researcher, but also with my funder hat on, is that again, stakeholders like the idea. It's intuitive. They like the idea of realist, the concept. I think the challenge, sort of reiterating what I think I said in the presentation, is that sometimes the way that we present the realist methods approach is a bit of a challenge for people to get their heads around, but they really like the idea, and they get the idea that it's about understanding how something works or doesn't work in its real life context. So I think favourably would be one word answer to your question on the whole, in my personal experience. Although there are challenges, as you state, in terms of engagement. I think Felix had a question.
Yeah, thanks, Joe. Felix Gradinger from Exeter and Plymouth Universities. I had the pleasure to work with you on your most recent implementation research project, and I think we'd had discussions about applying realist methods, but I just wonder, I never got a straight answer out why the decision was made, whether it was practical, logistical, might be to do with my skills in realist, but I wondered why you had decided to pitch that latest NIHR bid not with a realist framework after having successfully done so in other projects.
Yeah, two reasons. One, I personally wanted a bit of a break from doing some realist work. And the other was that at that time I was aware of the panel, of the board makeup, and I wasn't sure about how receptive they would be to realist inquiry. But that was 5 years ago. Things have moved on.
Thank you very much indeed, Joe. Please join me.
Coffee.
Yes.